In other words, beating ourselves up every day on a bicycle isn't going to make us live longer or even feel better. Many of us will feel exhausted for days afterwards. So we exercise under the anaerobic threshold for, let's say, 9 minutes of, say, a 12-minute segment. And then for 3 minutes, we'll push ourselves into the anaerobic range. So let's say your aerobic exercise heart range, let's say, is 90 to 110 beats a minute. So you're on the bike and we have monitors, you can follow your heart rate. Then, so let's say you do 9 minutes in that range, you'll do 3 minutes at 111 to say 125 beats a minute. And then you'll come back down and you'll do a little more. And you'll cycle like that. Now you don't have to do it for a 12-minute cycle. You could do it for a 3-minute cycle and do, I'm sorry, a 6-minute cycle and do 4 minutes in anaerobic and 2 minutes in anaerobic. I mean, it's, you know, it's not written in stone, but it's these brief bursts and exposures into the anaerobic threshold that truly build mitochondrial efficiency and competence and improve energy production. And if you can do it then simultaneously by using the supplements we've spoken of that would, let's say, augment energy function, and then by doing things to reduce toxic burden, you can, you know, and tweaking all the other little things. You know, if you're anemic, many people aren't anemic, but if you measure their iron levels, they're quite low. And it's very common in women who are still menstruating. And it's very common in athletes, of male or female, because you have this inevitable subtle blood loss through the GI tract. Well, borderline low iron can cause muscle aching with exercise. So in people with fibromyalgia, one of the simple things to do is just check their iron levels. And if they're inadequate, you could often help them quite a bit by just having them supplement with iron. If they're truly anemic, then building up their red blood count, if it's possible, will be very helpful. And so, you know, there are people with asthma or chronic airways disease. If you can improve that, that helps. It goes on and on. You know, whether the thyroid's low or the other hormones are low, we're always trying to tweak them. And the effect of toxic burden is its own lecture, and we could talk about it maybe a little bit in the next hour, but it can interfere with optimal energy production, aerobic energy production. Has been demonstrated to do that. And so in an ideal world, if money wasn't an issue, it would be great to test everyone and really be able to give them optimal guidance as to what to avoid. You know, could they be something in their diet or in their environment that could be injuring them, or how to mitigate a toxic burden to optimize their health going forward. Let me take questions for a few minutes, then let's take a break, and then I'm going to talk about the types of illnesses for which this therapy can be useful.
If you have anemia and your iron is fine, but your anemia is caused by a bone marrow disease,
right?
Will the oxygen therapy help you?
It will help a little, in a limited way. I do believe it will help. But the frustration is, of course, with the anemia your ability to deliver oxygen maximally is compromised. But I still think it would be beneficial. And you know, frankly, what we're talking about is a $60, let's say $120 investment of cash, plus the cost of doing the pre and post testing, to find out if clinically it makes you feel better. Now we can measure other parameters. We can measure other aspects of function, if you would. And of, for instance, if again money was no object, and this is my great frustration, we're really at the verge of doing so many sophisticated and personalized therapies, but the testing necessary to really understand how to go forward is not inexpensive, and it isn't covered by insurance. But having said that, you could measure, for instance, superoxide dismutase, which is an enzyme you make, a complex protein enzyme you make, which functions, let's say, at the end of the electron transport chain, the Kreb cycle, and not just the Kreb cycle, but many molecular reactions. You can't get a supplement of superoxide dismutase. So the electron transport chain is like a bucket brigade, if you would. There's a hot molecule created, which is important in molecular transformation, making energy or reducing toxins, etc. And it's passed on. And sometimes you use things that you can ingest, like vitamin C or vitamin E, etc. But at the very end of the chain, the antioxidant that finishes the job is made by your own body. So adequacy of production of that is a wonderful thing to measure, because it's a sort of a signal of, if you would, health and adequate cellular function.
How much does that test cost?
You know, I think, Tracy, if she's around, I think we could get it from Genova for, was it $65?
I want to say between 65 and 80.
Okay.
So, you know, but I like to tell people, and you can measure F2-isoprostane, which is a free radical, but a fat-soluble one. And so it lasts longer, and it's a more reliable measurement of oxidative stress. So on the one hand, you could measure the production of an antioxidant protein that's unique to, that your body must make. On the other hand, you could measure the height of this type of free radical. And so that would be a useful thing to measure as well. But you can also measure endurance capacity. We can measure what's called VO2 max, your exercise capacity. We can measure muscle mass and bone mass and all types of other things in order to try to see if this therapy produces benefit. So, for instance, Barbara, who runs this for us, can measure body composition, and she could tell you, given your weight, has your muscle mass increased and fat decreased? Or we can do what's something called heart rate variability, which measures the integrity of the autonomic nervous system. So we can do these non-specific measurements, for which we don't charge, just because it's interesting to us, to try to help understand whether there's some evidence of a progress.
That's very fascinating to me, the last part you mentioned. But I also wanted to tell you about the person that you knew with the wound that wouldn't heal. In Europe, they're doing bacteriophage therapy, and it's prominent in Russia. And what they do is they pack it with a virus that attacks the bacteria. And phage therapy, they call it. Actually, there's a place in Colombia here who had an office, but it's not catching on in the U.S. But the phage therapy works.
That's wonderful to know. You know, a lot of things aren't going to catch on because for whatever reason, someone can't own it and make money. A big company can't own it and make money from it, and therefore bring it through the FDA approval process.
Right. That's
so
the catch.
it's a problem.
Yeah.
I don't know what else to say about it.
Yeah.
Yes.
If you were going to start the process, where do you start? I mean, do you call the office and you say, I'm interested in this? Do you make an appointment to have a physical? What's the procedure for going through?
You know, I generally have confined the doing of these things to my own practice.
Right.
Because I felt that in order to maximize safety, it's best that we really know the person in there as much as we can know a person.
Right.
And so, you know, I know you well, and I know you're very healthy, so the goal would be to find the heart rate parameters and then get you going. But let's say we just simply did an oxygenation study, and if your levels were good, it wouldn't necessarily benefit you to do oxygen multi-step therapy. I mean, you might do other things in the gym, like the whole body vibration, which is very good for building muscle and bone mass. And you could still do the oxygen. You know, oxygen multi-step therapy, I often thought I should open up a little clinic in an airport. You know how exhausted you are from. That's the perfect place. But you know.